Hello, let's talk about a provisional restoration for a single veneer preparation. This is the preparation and this is the provisional veneer. It's different for a single veneer preparation than it is for multiple veneer preparations. If we were preparing multiple teeth for veneers, we would use a polyvinyl siloxane matrix and fabricate the provisionals with that polyvinyl siloxane matrix. So the thing that makes this difference is this person had veneers placed years ago. You can see some of these are going to have to be replaced because he's got gingival recession. I think he's not worn a night guard and the tooth is moved, causing the gingiva to recede on the adjacent teeth. But this is the one we're going to address in this video. So the first thing you do is you wet your glove. And I'm going to place that finger behind the tooth that's going to receive the provisional restoration. That's so this bisacrylate does not stick to the glove. So I'm using that to block the back side of the provisional. The objective is I want this bisacrylate to go through the interproximal contacts to mechanically lock the provisional in place. So I'm putting a little pressure on it so that the material goes through the interproximal contacts, and I'm kind of roughing out a provisional on the facial surface. And you can see I keep my finger behind the prepared tooth, but not over the incisal edge of the prepared tooth, because I want the bisacrylate to cover the incisal edge. So initially I'm just squirting bisacrylate straight from the gun onto the teeth and letting that set a little bit. Then I'm following that with flowable composite, and that adheres to the bisacrylate. And I'm sculpting this to get a generally good shape, contouring it with the plastic instrument. It's getting a generally good shape. Then I'm going to cure it. Then I'm going to come back and sculpt it with a fine flame-shaped diamond and a shofu disc. With the flowable, I'm going to generally contour the shape with this plastic instrument. Then I'm going to cure it. Then this is a fine flame-shaped diamond. I've over bulked the provisional on the facial, and I'm going to contour that. Then I'm going to go in and refine the margins just with a light touch. I'm not touching the tooth, just the bisacrylate and the flowable composite. Checking the shape with a large occlusal mirror to be sure the contour is in the correct arch alignment. Putting just a light touch, a lot of water, it's easy to contour, and then looking at the patient from the facial view and sculpting the incisal edge to make it approximately match the incisal edge of the adjacent lateral incisor. Just light touch here, sculpting the interproximal areas into the interproximal space, creating a little V shape interproximally. Remember, I don't have any adhesive on the tooth. The provisional is held in place totally by mechanical retention from the interproximal spaces. Then I'm going back with a light touch and polishing the facial of the provisional with the shofu disc. And you can put a very nice finish on the bisacrylate and the flowable composite with that shofu disc. Now the shofu rubber wheel is very effective for contouring the palatal because it will cut and shape the bisacrylate and the flowable composite, but it won't cut the tooth. So you can put some pressure on here. You want this to rotate from the provisional to the tooth. So you want it to rotate this way. And I have my assistant dripping water on the area for lubrication. A lot of water. And then once I've finished contouring, I'm going to take some of the primer adhesive, just a little tiny dab, and wipe that on the facial surface of the provisional to give it a glaze. Just the tiniest little bit. Then cure that. Check the occlusion. I want the incisal edge of this tooth to approximately match that one, the adjacent lateral. See how I've locked it into the interproximal area, and you've had your finger on this side, so it limits how far the interproximal bisacrylate will move to the palatal. It keeps it in that interproximal space, and there you have it. It probably takes 5 minutes to fabricate that provisional restoration for a single veneer. So that's the Dental Minute. These techniques work, and they work every time.
I know you want to take your practice to the top tier. Subscribe to dentistrymasterclasses.com for an organized library of all the Dental Minute videos, plus many complete comprehensive cases and many very important articles that you can only find right here. New cases are added weekly, and it's only $20 a month. Subscribe now.